I'm going to review my patient's chart for code status and allergies. I'm going to gather my supplies. I'm going to perform hand hygiene and put gloves on. I'm going to introduce myself. So, hello, my name is Skylar. I'm going to be your student nurse today. Can you state your name and date of birth?
Miss Adam, birthday is 10/12/98.
Okay. I'm going to be performing a head and toe assessment on you today. Nothing should be uncomfortable, just going to look, listen, and feel. So then I'm going to provide privacy and position the patient to the comfort level for him and myself. Okay, so now I'm going to begin your vital signs. And how old are you? And your gender?
No.
Okay, and can you state your height and weight?
5'8" white.
Okay. Do you have any allergies? Okay. Are you in any pain or anything? Okay, can you tell me what time it is today? Do you know where you're at?
Mm-hmm.
Where are you?
At home.
And do you know why you're here?
Mm-hmm.
Why are you here? Okay. I'm going to assess his responses for organization, relevance, and content. I'm going to assess his speech for clarity, quantity, pace, and volume. Okay, so I'm going to inspect grooming and hygiene. I'm going to inspect posture, see if the pain appears to be in any distress while sitting up. I'm going to assess your head for size, shape, symmetry, and masses. And then I'm going to assess your hair for texture, oiliness, hair distribution, thick or thin, and eagerness of growth. Now I'm going to note symmetry and facial movements. So can you elevate your eyes for me? Can you frown? Alright, okay. Can you smile for me and show your teeth? Can you close your eyes tightly? Okay, now I'm going to assess for hair distribution and alignment of his eyebrows and his eyelashes. Now I'm going to inspect your sclera for color. And can you take your glasses off for me? Okay, now I'm going to assess your pupils for size, shape, and reactivity to light. Okay, and can you look at the object? And then can you look past it? Okay, and then I'm going to move it towards your nose and I want you to follow it. Okay, so I'm going to assess for equality of eye movement and pupil constriction. Okay, now I'm going to inspect the external nose for any flaring or discharge. And then I'm going to inspect the nasal septum for any redness, drainage, swelling, growth. And then I'm going to have the patient to make sure they keep their mouth closed and assess for airway patency. So close one nostril and breathe in, and then close the other nostril and breathe in. Okay, now I'm going to assess the external ear for any cerumen, lesions, drainage, hearing aids, and then I'm going to assess the patient's ability to hear me. So now I'm going to inspect your lips, your gums, can you open your mouth for me, your teeth, your tongue, and the hard palate for any drainage, redness, swelling, bleeding, dryness, if you have any tooth loss, any cavities, edema, if you have any dentures. If you do have them, I'm going to ask that you take them out so I can make sure everything's okay. If you do have them, then I'm going to assess for their partial or full dentures and the location. So now I'm going to inspect the trachea for midline position, and then I am going to inspect the rise and fall of the chest for symmetry, breathing pattern, rate, and rhythm. So now I'm going to listen to your heart sounds. aortic, pulmonic, tricuspid, and mitral. I'm going to make sure that I'm listening at each of those for 10 to 20 seconds, and now I'm going to do 6 points on the front of the chest. I'm going to make sure that you breathe in and out with each listen. Then I'm going to do 8 points on the back. I'm going to listen 2 points on the side. Once I listen to the heart sound, I'm going to make sure I listen to your atrial pulse for 1 full minute. I'm going to palpate your chest for any masses or tenderness. Now I'm going to press down and can you breathe? Okay. Now I'm going to ask you to lean up, and I'm going to assess for any masses or tenderness. And then, can you breathe? And I'm going to be assessing for any asymmetrical movements as well. Okay. Now I'm going to be assessing your carotid artery, carotid pulse. So I'm not going to apply too much pressure or massage it. And then turn your head this way. Okay. Now I'm going to assess your radial pulse, your brachial, going to do your popliteal, your femoral pulse, and then I'm going to do your pedal. I'm going to do your pedal pulses both at the same time. Okay. I'm also going to do your posterior tibial pulse. Okay. Now I'm going to assess and compare your perfusion. So I'm going to turn your hands over. I'm going to palpate the field for perfusion. I'm going to check your capillary refill for blanching and pink color for the return seconds. We want to do the same thing for your feet, assess for color, temperature, edema, skin turner. I'm going to do your capillary refills for blanching and return pink color. So now I'm going to assess your abdomen for any scars, masses, or distension, and I'm going to listen to your bowel sounds in each quadrant, in all 4 quadrants for 10 to 15 seconds. Now I'm going to palpate your abdomen for any tenderness, muscle guarding, or any masses, and I'm going to palpate to see if you have any bladder distension. Now I'm going to do your perineal assessment. I'm going to assess your groin, your genitalia, and your rectum for skin integrity, discharge, lesions, and protrusions. Doing your skin assessment, I'm going to inspect your toenails and fingernails for texture and color. I'm going to inspect your skin for any redness, drainage, fistulas, ostomies, wound, skin integrity, any wound dressings for that integrity. I'm going to assess for moisture and dryness of your skin, any abrasions or lesions. Okay, I'm going to inspect your joints and extremities for deformities of your limbs, hands, and feet. I'm going to ask you to lean forward. I'm going to inspect your spine for any deviation or any curvature. Can you push your hands toward my hand? And then can you push it on this side? Okay. Can you show your shoulders forward me? Can you squeeze my hand? Okay. Can you hold your feet up and push down as hard as you can? Okay. And then can you pull up as hard as you can? Okay. Okay, so now we're going to be assessing your range of motion, so if you can stand up for me. Okay. So we're going to do your head and neck and just do what I do, okay? So forward, backwards, to the side, to the other side. Okay, now we're going to do your shoulders. So up, down, out, and then go around. Okay, now we're going to do your elbows. So like this, turn them this way, and turn them the other way. Okay, now we're going to do your wrist. So go down, up, outward, and inward. Okay, so now we're going to do your fingers. So do your fist, let your hands out, pull your hands forward, relax your hands, spread your fingers out, close them as tightly as you can, turn your hands over, and with your thumb, touch your pinky, then touch each finger after that, and then do it with both hands. Okay. Okay, so now we're going to be doing your spine. So if you can go bend down, and then bend back up, and then bend backwards, and then go side to side. Okay, so now we're going to do your hips. So bend your knee up, backward, twirl your foot around, go to the outsides, and then come back in. Okay, so we're going to do the same thing for the other leg. So bend your knee up, bend backwards, twirl your leg around, go out, and then come back in. Okay, now we're going to do your knee. So bend your leg up, and then bend it out, and then bend your knee back up, your other leg, and then bend it back out. Okay, so now we're going to do your ankles. So if you can press down like you're pushing on a gas pedal, and then if you can pull your foot back up, and then if you can turn your foot inward and then outward, and then if you can squeeze your toes, and then if you can relax and spread your toes out. Okay, and if you're able to hold your leg up higher, can you do that? So hold your foot out, press down, pull back up, go outside, and then bring your foot back inward. Squeeze your toes down, curl them down, and then relax your toes and spread them apart. Okay, so now we're going to be assessing your gait. So if you can stand up for me, and if you can take 5 steps forward for me. Okay, and then if you can take 5 steps, turn around and walk back towards me. 5 steps. Okay, so now I'm going to help you back to your bed. You can sit down. Okay, so I'm going to make sure I leave you safe and comfortable. I'm going to give you your call light. Make sure bed is locked in lowest position. The room is free of clutter. Make sure you don't eat anything. You're safe. I'm going to remove my gloves, perform hand hygiene, and then I'm going to document my assessment in the patient's record.